What is the difference between the anterior and posterior hip replacement surgery, and which one is best for me? Hello, I'm Bernard Kempker at Carolina Regional Orthopedics, and today I'm going to talk to you about hip replacements and their approaches. There are two commonly used hip approaches for hip replacements. The more classic one is the posterior hip replacement. The posterior hip replacement is a tried and true method. It does have slightly longer recovery times, and it does have a slightly higher risk of dislocation. The anterior hip replacement has a much shorter recovery time, is a less painful procedure, it is a muscle sparing procedure, and it has a much lower risk of dislocation. While both surgeries can offer a good long-term result, I would say that I think the anterior hip replacement is the better choice for most of my patients. The reason being is most of my patients enjoy a quick recovery, and within 2 to 6 weeks, they're without a cane or a walker and back to driving. I find that most people enjoy this procedure versus the posterior hip procedure, as the posterior hip procedure has a longer recovery. If you would like to discuss which hip replacement surgery is best for you, please come to Carolina Orthopedics, and I'm glad to evaluate.